is that you are talking with Ali's mummy. Ali's mummy is Suhana. Ali is a 7 year age old. Actually, he has some gut problem. For that reasons, we do the biopsy. Now the biopsy came as a positive for the celiac disease. So now you have to talk with about this biopsy result with the Suhana, and it is an information giving scenario. So you want to start or take
Mhm.
time?
Let's see. Information given already here. It's biopsy. Okay. Good morning.
Good morning.
I'm Dr. Raja, part of child doctor team that working in this hospital. I
Yes,
believe I'm talking to Mrs. Suhana, Ali's mother. Am I right?
yes, you're right.
Yes. Yeah. Nice to meet you, Mrs. Suhana.
Yeah, nice to meet you.
Mrs. Suhana, before talking about starting this meeting, would you like anybody to attend?
No, my husband is busy. You can talk with me.
Okay. Mrs. Suhana, first, I wonder if anybody tell you about Ali's condition.
No, nothing. No one informed me. I just waiting for the biopsy result of Ali. You have did. What's that?
Yes, I'm here to discuss with you the result of the biopsy that you are telling me
Okay.
about. Yeah, the result shows that Ali has a condition called celiac disease. Do you have any
What is?
feedback about?
No, I don't
Yeah.
know. What is that?
Yes, it is a condition that our defense system that is attacking the material that present uh, um, in the wheat. We call it gluten. Okay.
Okay.
Yes. So that's why when he was eating, he complained if there has tummy pain, and he is if you notice that he's distended, his tummy size increased, and he has loose motion. Am I clear so far?
You are clear so far, but so what is the treatment of this celiac disease?
Yes, because this is type of we call it allergy. That's why the defense mechanism is hyperactive. Okay, the
Okay.
treatment is to omit any part of food that contain this gluten. Have you any idea which type of food that contain gluten? Which means wheat or
No, no.
barley,
Okay.
wheat, and
Okay.
yeah. Okay.
So how
Uh,
long he will be omit this food?
what? Excuse me?
How long? How long he avoid this type food?
Yes, it's type of allergy. That's his body will not grow out of it, which means I'm so sorry to tell you it's lifelong.
Oh my God, doctor, what are you telling? Can you believe that? Can you imagine with me what happened if
Mhm.
he does not eat the cake, the sandwiches? What will be happen to my child?
Yes, just I want to tell you that we will arrange a meeting with diet doctor that he will elaborate more about this condition. And fortunately, the shelf of the markets, they have many kind of food that contain that it's not containing this gluten. We call it gluten-free diet.
Okay, understand. But
Yes.
one thing I want to ask
He
you, doctor, it's not that these are very much expensive. You are telling.
Yes, it's a little bit expensive, so that maybe we will arrange another meeting with the social services and we will check if you have insurance or not, so that we will apply to social service. Really, you are right about it's expensive materials. Yeah, but I want to tell you that he can eat freely the cheese, anything containing cheese, leaf, fruit, vegetables. He can eat but anything he can eat, you have to read if it's containing gluten or not, especially at the mark. That what
Understood.
chips, yeah, and some chocolates. You have to be so peculiar to check if it's contain gluten or not. Is it?
Okay, I
Does it
understand.
sound good? Yeah, yeah,
So is that the
yeah,
disease is running on gene like I have another child? Is that chance
yeah.
that Ronnie can be affected?
Mhm. It's a really nice question from your side, Mrs. Suhana. Yes, anybody that has this condition, the other part of the family should be
Just a
checked.
minute.
Yeah, as it run in the family. Okay,
Okay,
okay.
I
Mrs.
understood.
Mrs. Suhana, any other concern, please? I'm here just to
No,
to answer your questions. Mrs.
no, I have
Suhana,
no
let
any other
Ara.
concern.
Yeah, yeah, yeah. Mrs. Suhana, let's wrap up what we talk about Ali's condition. He has celiac disease, which is sometimes run in family. So that we need to check you and his father and any other part of his siblings. So that due to this condition, he has to avoid any food parts that contains this material. And just tell you, okay, and I will arrange a meeting with a diet doctor and social service, and even for the tummy doctor to elaborate more about this condition with you. And I will give
Okay,
you, yeah, yeah, I will give you some trustable website and some written leaflet and I will, if you don't mind, I will give you some social groups that their child have this problem. They may give you some idea about food that similar to bread. I mean, you may make at your home by rice, by oat that, but be sure that not contaminated by the gluten. Okay, and
okay,
yeah, this will support you. Thank you for your coming and your patience, Mrs. Suhana.
okay, okay. Thank you very much, doctor. Thank you.
Oh, you are
So you will
welcome.
remain like 30 seconds. You have to tell me which soon recovery, like that. Another
It's
important point you have means, first of all, empathy
uh,
is needed. It's a lifelong condition. It's not something good. Okay. So when you declare that unfortunately the biopsy came positive as a celiac disease, you have to give a pause. Okay, doctor. Like it's
mhm,
an upset news. Another want to tell you that one important information in me is that also we'll need to check him up every year at least to make sure that he's sticking to his diet, to measure his weight and height.
yeah,
And also in some children, not all children, they may have an increased risk of some diseases caused by this defense system, Ali's body like diabetes and thyroid affection, pointing to your neck. For that, we need to measure his blood
oh,
sugar and to test for thyroid function test every and now and then. Okay. So thyroid function test and
uh-huh,
diabetes we need to check. That information you need to share with me. And actually, about running gene, the answer is that actually it is not running in the genes, but tend to be clustered in families, and that is why we need to check his brother and sister. It is not
increase risk.
running gene. It,
Yeah,
there is increased
yeah,
chance getting brother.
yeah,
Description is like that. First of all, what
mhm,
is that? It is a disease that affecting his gut. Can you please follow me at this drawing to make myself clear? Okay. So I draw the
uh-huh,
pictures. When Ali eats protein called gluten, which present many in wheats and barley, it stimulates the defense system. Normally, our defense system acts as a soldier against the germs and bugs, but in this celiac disease, after being stimulated by this protein, it will attack the gut itself and leads to destruction of the inner layer. So Ali cannot be able to absorb the nutritive elements of the food and he will have diarrhea. So, OMG, what is the treatment? The treatment is that unfortunately there is no medical treatment, but the best treatment is prevention. Do you agree with me? So, what do you mean by the prevention? That is, by preventing Ali from eating this protein while giving a chance for the inner layer of the gut to build up itself again, and this diarrhea will be stopped, and Ali will be able to absorb the nutrients from the food. Okay, doctor, but how long we can
Mhm.
prevent? Unfortunately, it is for lifelong. When we tell that lifelong, we'll show the upsetness. Okay. Another, how can imagine that he is not whole life eating this? The answer is, I'm really understand how do you feel. But I can understand it is really difficult. But now in this era, we have many products gluten free and almost same taste as normal food. For that, we'll have a meeting with the diet doctor who will teach you exactly what should he eat and what should avoid. And I can reassure you that a lot of alternatives, good rye, oats, and barley replaced by corn flour, rice, potato, lentil soup, and pure maize. Are you with me? Okay, doctor. I think it's very difficult to do these foods at home. Getting it from outside so expensive. So we will discuss it with the social service to get it solved without any burden on your economic status. So this is all about. Okay.
Mhm.
Thank you.
Okay. You are welcome.